I continue reading Out of Many Lifetimes by Joan Grant and Kelsey. This is a book about their various cases. They're both therapists, hypnotherapists, but have very different methods of working. They were married. Joan passed away in 1989. I'm here in chapter 8, entitled Parenthood, and I think this is actually the fourth reading because it was quite a long chapter. I continue. This is Dennis speaking. Modern parents have abjectly accepted more blame for the shortcomings of their offspring than was their due. This was an inevitable consequence of allegiance to a philosophy which failed to recognize that every individual is responsible for the quality of his own character. Failing this recognition, it was natural enough for psychiatry to assume that a personality is predominantly an expression of the influences brought to bear upon it by the grown-ups, and most notably the parents. In truth, the parents can do no more than help a child to modify the character which he brought with him, to reinforce his benign aspects, and to change those attitudes which are diverting his energies from the course of his evolution. This is the essence of parenthood, bringing a child up as opposed to breeding, which is merely bringing one down. In the absence of a board of examiners to ensure that a couple is qualified for the task, there are some questions which all prospective parents should ask themselves. For instance, have we ourselves grown up? Have we resolved all childish attachments to our own parents? A couple who are still emotionally dependent on their parents are liable either to try to make their child conform to the standards of behavior which were imposed upon themselves, or else to fall over backwards to protect him from similar pressures. Whichever course they pursue, their treatment of him is likely to be inconsistent and often inappropriate. Only when they can see their parents through adult eyes will they be able to recognize which aspects of their own childhood they wish to hand on, and which should be scrupulously avoided. I've learned in the consulting room that if a patient who is adult in years spontaneously uses some variant of mummy or daddy as opposed to the socially or biologically descriptive my mother or my father, there's nearly always a residual dependency, which is a source of trouble. Such a patient, a man in his 30s, was a father speaking about the undue irritation he felt for his 6-year-old son. He was complaining that the boy was too babyish, and that by way of illustration was describing how on the previous day the boy had fallen down, had run bawling to his mummy, but in telling the story he also made a slip of the tongue. Instead of saying the boy ran to his mummy, he said the boy ran to my mummy, and this was the key to the whole situation. A considerable portion of the personality of this man, in many ways a most competent citizen, was seeing his wife as a mother figure, and resenting the son as though he were a rival baby, playing expertly upon the mother's sympathies. Only when this man had resolved this infantile aspect of himself did he become capable of being an effective parent. Not long ago, a married girl of 19 was enthusing about her forthcoming marriage and prattling happily of her intention to start a baby without delay. Her prospective husband had raised no objection, and she added, "Daddy will be simply thrilled." I next learned that on her bed she kept the doll, which she had since the nursery, and her attachment to this object was a further indication of her reluctance to relinquish her childhood. Finally, when I asked her position in the family hierarchy, she replied with another phrase, which experience has taught me is ominous, "I'm the baby." I was relieved to hear a few weeks later that her engagement had ended, because what she really wanted was a living doll to drool over. An infant who becomes incorporated into the mother's narcissistic fantasies is liable to develop the never-had-it-so-good syndrome. The essence of this is that the child is led to so to overvalue babyhood that he never wants to relinquish it, having been deluged with adulation merely because he happens to be a baby. he is likely to resist being prompted to enter the next phase in which he has to play a more active role in order to justify his existence. Another aspect of the same syndrome is that someone who during early childhood has become accustomed to an unduly lavish measure of praise and attention may become very anxious when, in new surroundings, he is accorded no more than he merits. This may lead him constantly to seek notice and approval in a way which earns him dislike. Therefore he is very likely, and with good reason, to lack self-confidence. He may try to hide his insecurity beneath a facade of brash assurance, or else develop feelings of inadequacy to a degree which is crippling. The next question is whether the prospective mother has any irrational fears about pregnancy or childbirth, for she should take steps to have any such fears allayed, rather than embark upon maternity in a spirit of gallantry. I say irrational fears because these are far more likely to be picked up by the fetus than fears based on public opinion or economics, and can be tantamount to a voice perpetually shouting at him, "I do not want you, your presence terrifies me." I think it highly probable, although this has yet to be proved, that the prevalent mood of the mother is reflected in the details of the microchemistry of her blood. So if she spends her pregnancy in a state of chronic fear, subtle changes in her blood may induce feelings of disease in the unborn child. Experience suggests that if he feels that his presence is genuinely welcome, he can take such hazards as motor accidents and air raids without suffering the slightest physical or psychological damage. Many parents regressed to the later weeks of intrauterine life have relived sensations which were caused by sexual intercourse between the parents. If this is performed gently and affords the mother pleasure, I believe it is thoroughly beneficial for the fetus. On the other hand, if the mother is submitting to the act only under duress, he is very liable to interpret the event as an assault upon himself, which may well increase any fears he already has that the world which awaits him is a hostile place. If a mother becomes pregnant merely to gratify needs of her own, to boost her ego, or to render her position with her husband more secure, it is as though her feelings, being concerned primarily with herself, bypass the incomer, who is left out in the emotional cold. As a result, he feels intensely lonely, and after he is born this may be a factor in causing him to develop very slowly. Aware of his mother's essential lack of interest, he fears that instead of giving him time to acquire self-reliance, she may withdraw her support when he shows only the first signs of independence. Therefore he fears to go forward, and seeks to bind her to him with his helplessness. When I became convinced of the reality of reincarnation, I realized that the importance I had attached to prenatal experiences had been exaggerated. But the fact remains that it is a period of no less psychological significance than any other, and therefore the last thing a responsible parent wishes to do is to provide a prenatal environment in which the child is likely to feel unwanted or endangered. The effect of this could only be to reinforce the unhealthy traits of his character, which were at least part of the motive for his incarnation. The event of birth, even a birth which the obstetrician would cheerfully describe as uncomplicated and the mother is as easy, is a frightening ordeal for the infant. Presumably the most accomplished trapeze artist is not entirely free of apprehension each time he risks his life, and similarly the infant. Although he has experienced innumerable successful births, is still aware that each one is a hazard. Experience with patients suggests that the infant knows he must be born just as clearly as we know that we have to die, and he may or may not feel ready for the adventure. I recall one woman, regressed to the period immediately prior to birth, who exclaimed indignantly, "But it is me who should say when I want to be born." She had been a brow presentation and appeared to recall deliberately moving her head into this position in an effort to resist the process, which it did very effectively, because instead of her head presenting its smallest diameter to squeeze through the birth canal, it presented almost its greatest. It would seem that if the intrauterine period has been ideal from the point of view of the fetus, he feels confident of surviving birth and is actually looking forward to the wider independent life which lies ahead. But if, rightly or wrongly, he has felt himself to be under attack throughout this time, then he sees the explosive forces of birth, which are entirely outside his control, as an attempt to thrust him into existence. So many patients have stressed the pain caused by the impact of noise and light immediately after being born, that I'm sure it is desirable to reduce these as far as possible. Voices should be hushed, and the clatter of instruments on stone floors, the banging of doors, and so forth should be avoided. It would be a kindly gesture to reduce the lighting, as the baby's head is on the point of emerging, and in order to mitigate the feeling of loneliness and separation, which seems to be one of the most painful of all the aspects of birth, the baby should be placed naked against the naked chest of the mother. A screen arranged across the waist of the mother would then shield the baby when the lights are restored to full power, so that the technical aspects of the delivery can be completed. The baby can be given its first bath at leisure, but then should be returned to the naked contact with the mother. Skin-to-skin contact is such a vital means of transmitting a feeling of security to a baby that far more use should be made of it, especially during feeding. I believe it is also important that the baby should always be within sound of a friendly adult. The custom which prevails in some maternity establishments of allowing the babies to howl their heads off, unattended in a separate nursery, has nothing to recommend it. Several patients have relived with acute distress, being held upside down by the ankles and slapped. Any maneuvers necessary to help the baby to breathe should be performed with the utmost gentleness. The weight of forceps dangling from the newly severed umbilical cord can make a baby feel he is being eviscerated. There can be no greater mistake than to believe that an infant is ever too young to notice. As I have tried to point out, he is able to notice and to register everything, but as he lacks sufficient intellectual equipment to interpret the event or to understand the reason for it, he is liable to react to anything which causes him pain as though it were a deliberate assault. This was well illustrated by a patient, a man in his 40s, who returned to consciousness after his first session under hypnosis, rubbing his lower lip and complaining that it was tingling. The sensation soon subsided but reoccurred on nearly every occasion that hypnosis was used. The patient had told me when I was taking his case history that at birth he had been unable to suck, and so when he was 2 weeks old his adenoids had been removed. Later in his treatment he suddenly regressed spontaneously to early infancy. With his mouth wide open as though fixed by a gag, his head rolled wildly as he emitted inarticulate grunts of distress. He was able to splutter, "They are hurting my throat," and when I asked why are they doing that, he blurted, "To stop me taking my bottle." As he uttered these words he wrenched himself out of hypnosis and exclaimed, "My God, how on earth could I have said that?" Then, rubbing his lip with a familiar gesture, he added, "That explains the tingling in my lip. It was something to do with the operation." I am convinced that infantile circumcision can be a potent psychological trauma. Assuming that the individual begins each incarnation without an unconscious, this operation is a powerful stimulus to construct one without delay. In the first place, even if perception of pain is not at its peak during infancy, the infliction of this mutilation is an agonizing barbarity. Very naturally the child holds his parents responsible for the assault, but because he realizes that they are also the people upon whom his survival depends, this invokes more anxiety than he can tolerate. So he thrusts his fear of his parents into his unconscious, whence it may reappear as a deep mistrust of the world in general, a resolve never to be cheated again, and a determination to get his own back. In addition, even the most balanced personality is likely to have an incarnation in which sex was associated with grief or guilt or fear, and nothing can be more calculated to arouse these latent memories and attach them to his current sexual development than such an attack upon his sexual organ. Anyone who has seen patients reliving their circumcision would share my conviction that it should never be performed except when there is a clear surgical indication that it is unavoidable. Another question which prospective parents should consider is whether they would be sufficiently clear-sighted to discern the real motives underlying various facets of their child's behavior. Obviously, I do not share the view that the personality of a child is an unorganized collection of antisocial impulses awaiting civilization, but it would be unrealistic to suggest that he will not have a number of basic attitudes which he needs to change. If the parents fail to recognize these attitudes, and they may be concealed beneath the most beguiling behavior, then they are simply allowing the child to reinforce those aspects of his character for which he will increasingly dislike himself. But to recognize a child's unacceptable aspects is only the first step. The next is to inspire him with a wish to change them. Fear may also change what a person does, but not what he wants to do. The only effective agent the parents can use to bring about their child's voluntary redirection of his energies is the filial affection and respect they have earned from him. To earn these, they will require a capacity for wise leadership. What is leadership? Surely it is a quality developed by a personality who, for a very long time, has been determined to exercise his power of choice, and has had the moral courage to act upon his decision. When a potential leader is seen to be moving with a crowd, it is because, on this occasion, his choice coincides with that of the majority, and not because it is the popular decision. Similarly, when he is moving contrary to the crowd, it is because his choice differs from theirs, and not because he wishes to stand out from the crowd or to rebel against it. As a result of always making his own decisions, and the experience he has gained through acting upon them, he is able to make up his mind more quickly and more wisely than people who have had less practice. Thus, more and more frequently he is the person who moves first. When the day comes that other people choose to follow him, he has become a leader. Every time that parents are hoodwinked by a child, or caused to reverse a decision as a result of his nuisance value, they become smaller in his eyes, and their capacity to help him is reduced. Obviously, even the most admirable parents will not always be right, but if they frankly admit their error, this evidence of human fallibility in no way diminishes the child's respect. Far from agreeing with the widely held view that a child must never be made to feel rejected, I believe that under certain circumstances, rejection is a very right and very effective policy. Nothing is more likely to cause him to wish a change, an aspect of himself, than the realization that someone whom he loves and admires finds it absolutely unacceptable. A couple who have learned to love each other possess the very best qualifications for teaching a child that love has to be earned by being lovable. So, this is the end of Chapter 8. Chapter 9 is An Assortment of Apparitions by Joan Marshall Grant. Have a good Saturday.